Yay Networks.
When we think about optimizing our wellness and really being proactive, we probably have a circle of providers of wellness professionals that we turn to. It's probably includes some of our traditional practitioners, our traditional physicians that we see for our annual checkups or things whenever we need it. We hopefully have someone we can turn to for nutrition, a registered dietitian, maybe a personal trainer, or another resource that we're using for guidance on movement. There's the full spectrum that we may think of resources, people that we turn to really help guide us and educate us. And I'm going to encourage y'all to add another person, another resource to your toolkit, and that is your pharmacist. This is someone who, over the years, I have really turned to the pharmacist for my own questions, for my own guidance. And it's something that I've always encouraged my clients to do. There's so much that they know, there's so much that they can help guide to really streamline and maximize our wellness. A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. When you think about the different resources that we have in terms of our wellness and kind of our go-to, the people that we trust, it may be your physician. You may have a nurse practitioner that you work really closely with, a registered dietitian. There may be a physical therapist who's been close in your life and part of kind of like your wellness circle. You may not think about your pharmacist as being an integral part of that, but they are, and they can be. And, I'm not a big fan of the word shoulds, but I think that I would go so far as to say they should be. This is something that for years when I've worked with clients, I'll guide clients that when we have medication questions, and there's so many questions that come up in different ways in working with clients, the instruction and the guidance that I've always given for decades is talk with your pharmacist. Schedule some time, stand off to the side if you don't have to schedule an appointment, but even just stand there, ask your pharmacist. Your pharmacist can be a tremendous resource for you. So we're going to talk about why it can be so beneficial to become best friends with your pharmacist. And to do so, I'm joined by Dr. Alisha Reed. Y'all may be familiar with her. This is her third episode with us. So welcome, Alisha.
Thank you for having me back.
Alisha is a licensed pharmacist. She's also a podcast host. Your podcast is
Your Self-Care Prescription.
I love it. So if you haven't tuned into it and you're finding this interesting and the content that we're talking today is interesting, definitely tune in, listen to Alisha's podcast as well. You can also follow her on social. I'll put links to your Instagram account's probably the best.
Yes.
For social. So where do we, and I'll also say the two other episodes that we did, I love. The first that we did together was the raw truth with you. And it was, it goes deep, it goes dark, and it has a lot of brightness to it with Alisha.
I think I have to go back and listen to it because I like to see the growth.
Oh, yeah. Where you were then, which was already a real far along from kind of the deepest level of loss that you had experienced. And so we won't, if you are interested, I think you'll love hearing Alisha. And I think if you want to know more about Alisha, definitely listen to her Raw Truth episode with us. And then we also did one touching on the weight loss medications. And that was even a few months ago when they really were starting to be talked about more. And we could do a whole nother episode on that.
There still are.
so much on that. But now our topic is how you can really maximize and why to maximize that relationship with your pharmacist. So you're at the VA hospital, and the VA hospital, y'all have all types of programs for veterans.
Yes. So the program that I'm working with now is specifically for home-based care. So these are veterans who aren't able to really go to their appointments. And so they have a care team that takes care of them in the home.
Which is amazing that is even a possibility. And with Ashnar, I know our pharmacists are very proactive, but a lot of people still don't know about it, that they can schedule simply a sit down consultation with the pharmacist to do what you and I are going to be talking through today. Things like scheduling that review of your medication, looking at ways that we can save money on medication, looking at how to organize medication. So we'll be talking about some of those things today, but people don't realize that that's something that you can, in many cases, actually make an appointment, or if not a full official appointment, that they can spend that time, carve out kind of off to the side with you.
Yeah. I think a lot of people don't know about what a pharmacist really does. And I think most often they just count the pills. And
right. That's all they see, right?
That's all. So they really don't know what a pharmacist can do, or, the tremendous amount of resources that are available to them when they have a pharmacist.
One of the things that I've always appreciated is that when you look at medication interactions, because the way that, I kind of explain it to clients is when your physician is prescribing that medication, your physician is focusing in that specific realm. And, whether it's cardiology or in these specific medications that they're often prescribing, but sometimes when that client is on something completely unrelated, they may also be on a very strong medication for rheumatoid arthritis. And how is that going to, interact maybe with other medications, and also supplements, nutritional supplements. And so those are things that, the physicians are going to typically be aware of, when they're prescribing a medication, the common side effects and the things that the feedback that they're hearing from patients. And then of course the information just about the medication, but it's the interactions that may not be quite so obvious.
Yeah. And it's also, pharmacists have extensive training in the medications. I know doctors rely on us,
right?
Because, our entire pharmacy curriculum is based on the study of drugs.
Right.
Whereas physicians study, the disease states and diagnosing them. So we are aware of the drug interaction. So a physician really does rely on the pharmacist to be that second check to make sure that, what they're taking isn't interacting.
That safety net. And so for our listeners, if our physicians are relying on those pharmacists, then we should too. So what are some of the things? And I'll also say we do have a third guest joining us, and you may hear our third guest in the back. It's Lucky. Lucky is the little duckling that we rescued just recently, as on the day she hatched, and her family was nowhere to be found. So for the past few podcasts that I've done, Lucky has been right at our feet. And sometimes you may hear her in the background. Sometimes she might want to join in a little louder, but if y'all hear it, it sounds like we could just like pretend we're in the forest or something.
Yeah, it's like we're outside. It's nature.
Are there certain, just over the years as a pharmacist, how much do people take advantage of it? Kind of when you've been a pharmacist in the traditional setting where people are coming in, getting prescriptions filled, how much do they take advantage of asking questions?
I think I would say that most people take advantage of, speaking to the pharmacist when it's like an immediate need. Like if you aren't feeling well and you're running to the store to find something for a stomach ache or a headache, then at that time, that's when you really ask a pharmacist a question. Otherwise, when you're in there picking up your medicine, you just want to get out of there. So, we are actually required by law to counsel patients. So when you pick up a prescription, a pharmacist should be asking you, or someone should be asking you, do you need to speak to a pharmacist? Do you have any questions? And most often, patients and customers decline it because they're in a rush.
Or they think they haven't really thought through how deep those questions could go.
Yeah.
Like right in this moment, I don't have questions about this, but maybe if you step back and you're looking at your medications in general, there could be questions. Yeah.
Because you get that paper that lists like all the things that could happen or side effects. And then usually when you get home and you're reading about it, I don't want to take this because this can cause this.
Right.
And then at that time, that's when they pick up the phone and they'll call and want to speak to a pharmacist.
So the first thing that we'll recommend, and we're going to kind of go step by step through things, we'll talk about, that medication review, kind of that medication management. And then we'll talk about looking at potential for cost savings. I'm going to ask Alisha to kind of walk us through on that. Then also organizational strategies for it, and also the expiration dates on that. We'll talk about those things. So first, for starters, is schedule a review. For most pharmacists, I know like with Ochsner, you can schedule an appointment just like you would with another type of provider. How many pharmacies offer that, or is that common, or?
It depends. Most community or retail pharmacies should offer that. There's a program, it's actually called medication therapy management, that a lot of retail pharmacies and community pharmacies
Okay.
participate in, and it's really offering a comprehensive medication review. Most, most people don't take advantage of that.
Okay.
Your insurance may cover that, but you can always ask for someone to review your medications,
Right.
like a pharmacist. There should be an initial or a quick review when you are getting a new prescription,
Mhm.
and it's input in the system where they check to see if there's any drug interactions. But one caveat is that can only happen if you are getting your prescriptions filled at the same
Right.
pharmacy or the same chain pharmacy.
So even if you're not sure, that's something that you can ask. Does your pharmacy provide that? Even if they don't provide official appointments, you could still ask your pharmacist or ask the pharmacist, hey, can I share with you everything that I'm taking? And even if you had to come back at a later
Yeah.
date and kind of schedule a one-off with that, most of them are going to be happy for that. If you're going to a pharmacy that does such high volume, we could call them like the big box pharmacies, they may not have the capacity for that. And so that could also be a reason to support a local pharmacy, a locally owned pharmacy. I'll say though, in my experience, kind of like you were saying, the oh, by the way questions, like when I've got this weird thing going on, what should I take? Even at the big box ones where I'm kind of running in a last minute panic to get something, I've experienced just such help in that, just this kindness and support and help, even though it might be a bigger chain. And the same as I do for the locals, or the same as like for an Ochsner or something like that. So scheduling that time, ask if they have it. If you aren't getting all your prescriptions filled there, before you ask for it, get yourself together, get your medications together, because they're going to need to see which medications, the dosage, the frequency that you're taking it.
Yeah. And I also want to stress that it's important for you to have a list of everything you're taking, because most people only think about the prescription medications, but you're taking something over the counter, or, something that, you saw on TV that you purchased. You need to make sure you have a list of all of those things, because a comprehensive medication review involves checking to make sure all of those things are able to be taken together.
If you're taking something that you saw on TV or got promoted to you in a Facebook ad or Instagram ad, the answer is probably stop.
Yes. Yes.
Not at all costs,
Yes.
not always, but probably. But jokingly, but to Alicia's point, also thinking like herbal remedies. There's a lot of supplements out there for different like weight loss things that maybe have different herbs, and it's so surprising that all of these can still interfere with medications. St. John's wort, you haven't heard people talk about that in a long time. People used to take it for depression, mood. Well, St. John's wort can interfere with the effectiveness of birth control.
Yes.
I had a client who got pregnant with that.
Yeah.
And okay, you're taking that for depression and you had no intention of becoming pregnant, and now you are. So it's like those things they're real. They happen. So and in many cases it can, if you're taking blood pressure medication or different types of heart medications, some of those supplements or herbal supplements, they can almost increase how much that medication is working on you, or they can decrease the effectiveness of it, almost as if you were without intentionally reducing your dose or increasing your dose.
Yeah.
And you're not doing that, but these other supplements or other products you're taking, it could be weight loss supplements, any of that stuff can essentially have that effect with your medication. So scheduling the consultation, get yourself together, have a list of everything that you're taking, your prescription medications, your over-the-counter medications, and any supplements, things that you're buying at a vitamin shop, something you saw on TV or an ad. And even if you think they're going to you're kind of maybe a little embarrassed by it, this isn't the time to hide anything. This is put it all on the table.
Yeah. Because there's also times when you may be experiencing a side effect or something. And a pharmacist may be looking at all the things that you have been prescribed that you have had filled at the pharmacy. And you're like, oh, well, none of these things cause that. And then it's like, oh, by the way, I'm taking this supplement or this over-the-counter med. And that may be the med that's causing the problem. So we really need to know everything.
When you and I did an episode before, I mentioned to you my dad, and he just was started taking certain medications, and like the beta blocker, that was one that kind of stood out to you as what was leaving him feeling so lethargic. But yeah, so I think step one, y'all, schedule that review, get yourself together. If everything you're getting is not filled through that pharmacy, bring it all. And then again, all the other things that you're taking and the dosage.
Yeah.
It can be helpful if it's too much to write it all down, just bring all those bottles in with you. There's nothing wrong with that. I've had clients do that for years too. I mean, they just bring a sack and they've got everything they're lining out.
We used to call it brown bags.
Yeah.
It's like, there's some communities that used to host those, like with organizations where it's called a brown bag
Oh, that's
review.
neat.
And you just bring your meds.
Yeah.
And there's a pharmacist that's there going through everything with you.
I've done that with skincare with the dermatologist too. You just throw it all in and they can take it, look at it. And because as that expert, they're going to be able to look at it more. And so it can be even more effective. Yes. Brown bag it, put all those pills, all those bottles into that bag, bring it, or do the modern day version of brown bagging it, which is basically screenshotting the label on your phone and then swipe through. So when we're talking about, I guess next, let's talk about, I think, money. What are some of the biggest tips that you have for like cost savings on some things for people?
Yeah, I think what's important to note is obviously TV commercials, ads, all of the new drugs are appearing and, they're telling you to ask your doctor to prescribe this for you. Those medications are going to be the most expensive because those are new brands. They don't have a generic available. But those are the meds that most people are wanting because they're seeing the commercials.
Right.
My advice would be, if there's something else that's available, I would always ask a physician, is there another option? Because, you also have to think about most of the time, drug reps are coming in.
Right.
They're sharing their information about this new drug. It may have great data. And it's a drug that's recommended and that may work, but it's expensive. So I always say to ask if there's a lower cost alternative. Like if there's another drug that can work just the same for me, that costs less.
Just as we're seeing it on TV, perhaps, or we're seeing it in different types of advertisements, wherever we're seeing it, our physician is also seeing it because those same companies that are paying to advertise it to us are also paying those drug reps to call on the physician. So it's also going to be, it's top of mind for us. We're seeing it. It's also top of mind for your doctor. So when we're talking about, is there a lower cost alternative? That's the conversation that we have with the physician as they're writing the prescription.
Yeah.
Not as much later with the pharmacy.
Well, you can have it with the physician and then also with the pharmacist because the pharmacist may be able to, in perfect example, when you go to fill that prescription and you get that whopping copay, it may be $200. Then at that point you say, hey, is there something else that, would be a cheaper alternative? And then that your pharmacist is able to communicate that with you or reach out to your provider.
I've always appreciated it when the pharmacist gives me a heads up. Sometimes you call ahead to fill it or go online to fill it. And before they do, they'll say, hey, it was this much, so it's versus the sticker shock as you show up. What about getting a larger supply, like a 90-day supply versus a 30? Is that make a difference?
It depends on, your insurance plan or, how you're paying for your prescriptions. I did want to mention generics obviously is a great way to lower lower the cost, and just also share that generics are just as good as brands.
That was going to be my next question
because we have an idea. Well, I only want the brand name, and when you want the brand name, then you're going to pay for the brand name. I will say that there are some classes of medications it really does matter if you're on a brand or generic, just for consistency. Something like a thyroid medication or warfarin, like a blood thinner. You want to make sure that if you're going on the brand, you stay on the brand, or if you're on the generic, you stay on the generic, just for your lab.
So each are good, and the generic is great, but you don't want to toggle back and forth.
Yes.
Once you go away one way, just stay that way.
Yeah.
And if you're going to switch, make it known that you're making that switch, maybe from the brand name to the generic. You may need to be prepared for an adjustment. Yeah. And then once you get on that generic, don't keep going back and forth. Yeah. So the generics, we can have faith in those. We can trust them.
Yes.
We can ask our physician. And if we didn't ask our physician in time and we have that sticker shock at the pharmacy, we can ask for the generic. And then on the 90-day versus the 30-day, it seems like that would make sense when you might be paying a copay or something.
Yeah, but it also depends on, your insurance, because sometimes the copay is just 3 times as much.
Okay.
As,
really?
Yeah. Is it 3 times as much as?
So you're not outsmarting it.
No,
not every time.
But some insurance plans, and that's also important when you are choosing your insurance plan. You want to make sure that you pay attention to those things. Like, is there a cost savings? if I do get a 90-day supply, because some plans want you to get 90 days because that increases your adherence, because you're having to fill it
Right,
less.
right.
But you want to make sure that you have a plan that has that option.
What about when people want to cut pills in half? And I think, if they would say the physician, they would ask the physician to prescribe a pill that's higher dosage and then they cut it in half. I've had some people try to navigate that. Is that advisable?
I think that works the same way with, asking for a 90-day supply.
Yeah.
I would also caution that not all medications should be cut.
Yes.
It depends on if we say that they're scored. So if they're scored, they have the line in it, they are meant to be cut in half. And then there are also medications that shouldn't be, if there's something that's like a delayed release medication.
It's got basically a coating on it that's going to make it, basically our bodies are going to absorb it at a very slow, steady rate. And if we cut it, it can shoot it up really quickly.
So those are situations where I wouldn't advise cutting tablets, and then it depends on the population. If it was an older patient, I wouldn't recommend that either.
Just at all.
Yeah.
I mean, for me, it's hard. Like you've got to get the reading glasses on, and the pills can be really small as it is. And so when you're cutting it, they become just like microscopic.
Yes. Some of them are disintegrate. So
right.
Because then it's really and then if you put all the halves in the bottle, you don't know if it's really a half
or is it a crumb?
Yeah.
Yeah. Right. I feel the same way. It would not be my preference. I think it would have to be a really big cost savings for me to want to do that. But I think if that is something that you're thinking about, that's something to at least just ask your pharmacist first, have that conversation first. Don't just go willy-nilly cutting them in half. And even if they are scored, just be mindful of those things that Alisha and I were talking about. What about different things that there are? I've seen things where different drug companies may have patient assistance programs. Yes. How effective or how much do those actually follow through to really show a cost-saving benefit to patients?
It really depends. I know as a pharmacist, when you're processing these coupons, there's a lot of fine print.
Yeah, that's what I've run into every time.
So it may, while it sounds good that you can get this $25 coupon, you cannot have a Medicaid or Medicare plan, government funded program. So there's a lot of stipulations.
Right.
So in those cases, you may not be able to use it.
I've talked about GI things before on this podcast, and I was diagnosed with SIBO, small intestinal bacterial overgrowth, and the medication for it is rifaximin.
Yes.
Oh my gosh, what is it, $1,400?
Yes.
It was over $1,000 for a 14-day supply. Yes. Maybe it was $3,000. It's
very expensive.
It was, and so I was looking at all the different things to kind of provide the assistance or things that would be ways to bring it down. And it was sort of like you said, there was so much fine print on it that even though it would be oh wow, this is great, this can make it a more affordable option, none of them actually followed through. So not to sound negative, I actually am sounding very negative on that, but you could always try it. There are pharmaceutical companies that they provide, they can provide these patient assistance programs. In some cases, I've read that companies like Eli Lilly or Pfizer may provide medications for free for people who meet certain income requirements.
Yes. So there's that option. Then the physicians probably won't like me saying this, but some physicians have samples.
Okay.
So that may be an option.
Right.
I know when I worked for a Medicare health plan, we would reach out and ask if physicians had samples available in the office to help those patients that were in the gap, the coverage gap.
Yeah. That's a really good point. So there's different things that you can do there. And then there's also, there's different discount cards and coupons. GoodRx is one. There's a nonprofit group that I read about called needymeds.org. Have you heard of that?
I haven't.
Well, I'm not familiar with it either. I'll put it in the link in our show notes, but, it's a nonprofit group that is, it basically connects people to deals or kind of informs people about different discounts or things on medications. So we'll put that in the notes, but thinking through, okay, there's some medications that I'm always relieved when you pick it up and they're $7. You're like,
cents.
Right. And then there's others that you got to think how much do I need this? And so that also goes back to schedule that comprehensive medication review with your pharmacist. What about an organizational system for medications?
Oh, yeah. So I would say as you get older and the number of medications you take increases, obviously pill planners are very helpful, and they've evolved so much. Like
They're stylish.
because I mean, there's one. And I don't want to shout on any brands, but there's one particular one.
Shout it, because I'm going to put mine on there. I'll put my favorite. What's yours?
So I like the Cadence. It's like the organization system, and it's magnetic, and it's like you can not only use it for pills, but you can like put like your hair stuff in it, like when you travel. So I like it because I can just put them in there. But I also have just another like little pill box like my friends gave me, because they were like, you travel with your bottles, and that's a whole nother reason I like to travel with bottles, just in case something happens. And I don't want just unmarked pills.
Unmarked pills.
So I travel with bottles for a reason. But they gave me a cute little pill purse.
We're going to make it easy for you.
Yeah. But there's all kinds. And then there's apps that you can download to remind you to take your pills. So
but you know what? The person who needs that much reminding is usually often going to be maybe the senior. I think about like my mom. She had towards the end of her life a lot of health challenges and medications between her and her husband. That was a constant challenge. And an app would have been zero help. Yeah. And that would have
we could just set alarms.
Oh my God. The confusion of that though. He needed the old fashioned notepad and scratch through it when he did it. But I'm going to ask Alisha to send me the link to Cadence that you talked about. And then I'll put the one to mine. I don't think mine is nearly as fancy as what yours sounds like, but you've got to find something that works for you. And I have the things that I take in the morning, the things that I take in the afternoon. I like to have it where I can take them out separately and take each. If I'm only going to be going out of town for 3 days, I don't want to take the whole case. I like to be able to take just those 3 days with me. So I think finding a system that works for you of what that looks like. Let's take a minute to talk about one of our sponsors for this week's episode, HelloFresh. From chef-crafted seasonal recipes to their fresh and fit menu, HelloFresh brings flavor right to your door. Pre-portioned ingredients helps to cut down on food waste, while their step-by-step instructions make cooking a breeze, not a chore. You can turn your wellness goals into realities with HelloFresh plans like Protein Smart, which is centered on protein and veggies, or their vegetarian or pescatarian options every week. HelloFresh is such a time saver, plus it automatically adds that pop of variety into ordinary weeknight meals, and we've loved every dish that we've tried. And some cool news, Green Chef is now owned by HelloFresh. I love personally switching between the brands, and now y'all can enjoy both brands at a discount too. Go to HelloFresh.com/50Fueled and use promo code 50Fueled for 50% off plus free shipping. That's HelloFresh.com/50Fueled, promo code 50Fueled for 50% off plus free shipping from HelloFresh, America's #1 meal kit. Let's take a minute to share about one of our partners for this week's episode, Caraway. Their thoughtfully designed sets and complimentary storage system makes getting and staying organized easier than ever. Caraway's non-toxic kitchenware collections make cooking and baking a piece of cake. We love our Caraway cookware. It's our go-to for everything from seared salmon to creamy spinach to our Eat Fit candied cashews. The pans heat up quickly, they cook evenly, and they're incredibly easy to clean. And with our exclusive discount, you can now save on the full suite of Caraway products, including their internet famous non-toxic cookware set, also Caraway's food storage, tea kettle, and mini cookware. Visit carawayhome.com/fueled to take advantage of this limited time offer for 10% off your next purchase. This deal is exclusive for our listeners, so visit carawayhome.com/fueled or use promo code FUELED at checkout. Caraway, non-toxic cookware made modern. Talk to me about the, there's like pill packets that pharmacists can put together, and it almost is like you would pull them out of the box. They're like,
yes,
I'm not explaining it right. I have the visual for it because we did that for my mom, and that actually made it so much better.
So it's like a personalized packet where all of the meds that you take are just in like a daily packet. And I've actually done that with a vitamin company.
It's like a little blister pack.
Yes.
Yeah.
And it's, that's easy where you just pull out that packet.
Yeah.
And that's all your meds for the day.
And it's almost the one that that mom and her husband had. It was like little blister packs, and they were all connected in a big reel, almost like a tape dispenser.
Yes.
And so it's in a little cardboard box. You pull it out, and then that has everything that you need to take in that day. So you're not having to open all the different
Yeah.
bottles. And then also, a lot of people, you have, spouses or people in the same household. It can be really easy to mix up each other's medications, which is a whole nother thing.
Yeah.
My stepdad took some of her medications at one
Yeah.
point, and that was terrible. Yeah.
We don't share medicines either.
And so intentionally or not intentionally, we want to try to avoid as much as possible. And so if you have, because I know that a lot of people listening, it may not be for ourselves yet, but these kind of pre-sorted pill packets that are like these little blister packets, they're basically bundling the right dosage of each of these medications. So for example, if you needed to take, I don't know, 2 pills in the morning and 1 pill at night, well, that morning pack has 2 pills of that medication, the other pill of the other one you need to take, and just the right number of each of the types of pills in each pack. How does someone get that going if they're interested in like exploring that for a parent or grandparent?
Yeah, there's several companies. I can't think of a company offhand. I think Amazon may offer that. But the pharmacist in me has a con to that. And it is if your dosage changes.
Yeah.
So if you are,
it locks you in for the next 30 days or whatever.
So, if you have to take two of one of the tablets now, then it's like you have all these packets, and do you start over or do you just open them all up and then you're back at square one?
I get that.
So that's the only, caveat.
So if you're pretty sure that the medications you're taking are going to be consistent, and I think for people whose parents or grandparents, maybe medication management is such a challenge, this could be a solution, even though just knowing that would be something to be aware of. If there is a change, it can be a cumbersome change to make. Yeah. I do remember now that you say that, Dick, my stepdad, would cut open some of them and then remove whatever that pill was and then staple them back and then put it back in the tape roll. It was, it's a lot. You're right. So finding that organizational system, whatever it takes for you to kind of be consistent with that, because of course that's going to be like the most important. We'll put some of our favorites there. And then when we're talking about, streamlining everything and being the, most efficient and minimizing waste, what about the expiration date? How much does that matter?
It matters. I know for cost savings, a lot of people don't want to get rid of medicines. They want to hold on to them for as long as possible, just in case they may need it. I know there are some individuals that may hoard antibiotics or, just in case I get sick again. But, those expiration dates are there for a reason. Now, if you when you get your prescriptions filled from the pharmacy, you will see that there is a date on there. The date on the bottle is usually a year from the date it was filled, just because, just for consistency, pharmacists, they want to make sure that after a year, unless it's something that's newly prescribed, then you shouldn't still be taking it. It should be gone. So that isn't really always the exact expiration date. It's just the expiration date from the pharmacy.
Right.
However, if you purchase something that has an actual printed expiration date on it, I would toss it when it's expired. And that's only because most people ask, well, will it hurt me? The answer to that is we don't really know, because when a drug company or a manufacturer puts out a drug, they're testing the stability, and they're telling you that this particular drug works. And when you go beyond that expiration date, they can't tell you what'll happen.
Right.
So you don't know if it's if it's effective. If you're using a medication for heart chest pain, you're taking this medication that's expired, it may not work.
I was reading that especially certain types of medications, once they're past their expiration, they're going to be either less effective or not effective. And so it's probably, you're not going to have a negative effect. The exception that I was reading though was antibiotics, because they are maybe lower potency, so they're not effectively treating that infection, which could lead to that resistant bacteria.
Yes.
So something like expired antibiotics could be one of those situations that could cause more harm than good.
Yes.
Which that's stunning, because you're right. I mean, people get a prescription for a Z-Pack and they sit on it for years.
Yeah. I'll just save it, or they won't finish it because they start feeling better. And that's another pharmacist counseling tip, that, you finish your medication. If it's a 7-day supply, do the whole 7 days, even if you start feeling better.
Is that especially antibiotics?
Yes.
Okay.
Take the whole course of therapy.
If it was something else like an anti-inflammatory medication or something like recommended but not as essential, like is antibiotics kind of the most essential that we must take the full course?
That's the full course. something like anti-inflammatory, it's usually like a as needed
Right.
medication. And when you have things like that, it's really, something that you should take as needed. I know a lot of patients get confused and think that they have to take it every single day.
Right.
And it's like, if you don't have the pain anymore, then it's only as needed for pain.
Which goes back to schedule the consultation with
Yes.
y'all, and then also open communication with your physician. There's some medications too that are refrigerated. So I'd imagine those have a much shorter shelf life.
Yes. So it was, insulin is a great example. So there are some insulin vials that can be left out of the refrigerator for 30 days, for 45 days. So it just depends on how you're storing them. And so it's very important to pay attention to the information that you're given on your bottles or on your boxes, because it'll tell you to store, in a refrigerator or to keep away from extreme heat, because your medications really should be stored in a cool, dry place.
Which is not the bathroom, which is where a lot of people have them.
Yes. And not in the car.
Right.
Yeah.
Yeah, you're right. People keep them in the car and the console because you think, I'll take them and I'll remember because I'll be right here. Or in the bathroom, but you've got all this heat and humidity.
Yeah.
So cool, dry place. So it may be the pantry, or it may be someone's closet, or like a kitchen drawer or cabinet.
Yeah. It's like I have mine in the kitchen, and it's just like in the cabinet. So like when I'm getting my coffee in the morning, it's all there.
Right, right. And do you have any such, like, how often do you see or hear that spouses or people within the same household do overlap medications accidentally?
I don't really hear it accidentally. I hear it like intentionally, because it's like, oh, I don't have my fluid pill, but my wife has the same one, so I'm going to take it. Or, I mean, that's a cost saving,
right? And you kind of can't blame them for that. So I guess that's one that if they were taking each other's medications like that, that would be another question for the pharmacist. Like, if someone says, my wife has this prescription and we can share it, don't do it without asking first.
Well, I would say don't do it. Like, I don't think any pharmacist is going to say, oh, that's fine.
Yeah.
No, because you just want to make sure that you're taking what's prescribed for you.
Because also, okay, that's a fluid pill, but then what if it's a more substantial medication that might have a very significant side effect,
Yeah, not only that, I mean, if you may be allergic to something.
Right.
And then, you take it.
So scratch what I just said earlier, because Alicia's going to tell you no, no matter what.
Tell you no matter what.
Any other things that are kind of like tips or strategies or things that you see go wrong that with just a little bit of education could easily go right for people?
Yeah, I think one of the most important things is over-the-counter medications. I know a lot of people tend to self-medicate. You have a fever, or, you have a cold, and you go and purchase cough and cold medications from, the drugstore, not realizing that you are a diabetic and you should not take this cough syrup because it has sugar in it, or you have high blood pressure and this particular cold medicine has something that's going to raise your blood pressure. So I would say, that's when you need to ask a pharmacist, because those are questions that we are trained to ask.
Right.
Hey, do you have high blood pressure? Are you a diabetic? Are you pregnant? Because there are some things that, you cannot take. So I think that is one of the takeaways that I always stress, is make sure that before you pick up anything, just ask. And with kids as well, there's actually a Pepto Kids now that's on the shelf. And an average person would believe that, okay, these are the same things. So if I have Pepto-Bismol at home, I can just give my child a smaller dose, because most people think little human, right? Because it's a child. I'll just give them half of what I take. Well, the active ingredient in real Pepto-Bismol, kids shouldn't take, because it has like an aspirin in it. So the Pepto Kids is really just like a Tums. So as a pharmacist, I know that those are two different things, but someone who's shopping and you and your
just
child,
think it's a lighter version,
and you and your child both have diarrhea. Well, I'm not buying two.
Right.
That's a marketing scam. I'm just going to buy one. In that particular instance, you really do need the different ones. So I think those are things that are often overlooked.
That's something I would never have even thought of too. What about when someone's like, how much of an issue is it of how people are getting rid of medications or throwing them away?
Gosh, yes. So that's something else that comes up often. Some people may say that they flush them down the toilet, which is not not recommended.
Because of environmental
issues. Um, the correct answer would be, there are drug take back days that are advertised, which is, one of the best ways.
Is that at pharmacies?
It's actually, I think the DEA does it,
Mhm.
and there's
Okay.
like a setup. I mean, that's one of the ways, but it's not all the time. So you'll have to wait for then. But the pharmacies also sell. There's a bag that you can get at the pharmacy, and you put your medications in it, and then it's an address on it, and you can mail it back.
Oh, okay. So kind of like a prepaid or,
So you can purchase that. And then they also say to put them in like coffee grounds. And like in trash cans. So
what is the reason for that? Because that's what I was just pointing at something to show Alyssa. I was like, this is hilarious that it just struck me as funny. It said, mix the medications with something unsavory like dirt or coffee grounds or kitty litter.
Yeah.
Is it so that someone else isn't taking them?
Yeah, that's really it. Just so that, someone doesn't go through, all of it. Because it's like, you aren't just putting pills out there.
Right. And do you think this is mostly for things that would be stronger medications that might be like pain pills or opiates, or is this all medications?
Well, I mean, there are individuals who are just drug seekers, so that doesn't matter what it is.
They see a pill, and who cares if it's for your cholesterol or hypertension?
Yeah.
It's attractive to them.
Yeah.
Interesting. So put it in something icky like dirt or kitty litter.
Yeah. But I mean, I would talk to, don't go bringing all your meds to the pharmacy, because that's another misconception.
Old medications.
They bring old medications, because the pharmacy really can't do anything with them. We're not allowed to take anything back. But there are the envelopes that you can get, and you can mail it, and it goes to like a destruction center.
Okay. No, that's good to know. And as I was looking at the recommendation of the dirt, coffee grounds, or kitty litter, that's if you're putting it into your own trash. And the idea is that it makes it unappealing, not only to people, but also animals. Which makes sense.
Yes.
Yeah. Okay. Any other things, like any revelations that you've had with people, or things that you can think of that, like, that our parents or grandparents could like benefit from hearing, or us, there's just things that like one big one that I do is I use the Oshner Pharmacy, of course, and the mail order option is fantastic. So it's still through my pharmacy, but instead of, stopping in and picking it up, they can just drop ship it to me. Yeah. And that's easy. You can order, click on an app or go online to order it, or do the old fashioned calling it in. Yeah. But then if you go pick it up, you might need it right away. But when you order it and they send it, it's within 2 or 3 days. Yeah.
I think what's important is don't wait till you're out of refills to need, request a medication, because you have to remember that your doctor has to authorize refills. So pharmacies aren't able to just give out pills, in certain situations. If there's like an emergency or, a declaration, then pharmacists are able to give a temporary supply, but that has to be, mandated where we can do that. So it's technically we're not able to say, here's 3 pills until your doctor authorizes your prescription. And I think that's where a lot of people get into trouble, because, they're out of their blood pressure medicine. So if you're looking at your bottle and you see that this is your last refill, be proactive and contact your physician. You also just don't want to run out, because the drug may not be in stock and the pharmacy may have to order it. So I always advise, put your medications on auto refill if a pharmacy offers that. Make sure that you have your prescriptions. Whenever you see your physician, just ask them to refill everything so that you at least have a prescription on file. Another piece of advice would be don't be afraid to ask questions, because there are a lot of things that, patients may not understand when it comes to directions, and what's printed on the bottle may be confusing. So when you get home, it's like, wait a minute, I don't remember what my doctor said, how to take it. There are some instances where doctors may say, just take, in the directions they take is directed. And it's like, okay, well, what did they tell me to do? So I would ask questions, and because you wouldn't believe how many questions we have gotten that's like, okay, no one explained to you what this medication does. Or if you're reading something and this medication says it's for seizures, I'm not having seizures. What's being used for migraines? So, those are questions. Like, don't be afraid to ask, if you're unsure.
And even if your physician did tell you, but there was information overload, it's a lot sometimes, ask, are we okay with when someone writes on the top of the bottle, like if it says like, this is like 1 a.m. I see like there's a lot of markers written on the tops of the bottle that is like their own personal instructions to themselves.
Yeah.
You're fine
And
with
I
that?
think, and that's fine. Because however you have to remember.
Right. Whatever that system is. So when we think about like our whole body wellness, I think we often think about how much we're moving, what are we putting into our bodies, how are we nourishing our bodies? We're starting to think more about sleep and, how we're handling and what we're doing to like release stress. I think something that does get overlooked is that medication management. And there's a lot to think about there. If you're only taking one medication or no medications, obviously it's a non-issue. But if you are taking if you take even just one medication and you're also taking several different supplements, this is something to still take that time, sit down, with your pharmacist, do that deep debriefing, bring all your products in, do the brown bag thing where you're bringing all those bottles so that you're not just putting the name of it and then there's a frustration because they're not, they may not know all the other ingredients that go with it and then you don't get the full answer. So just go ahead and bring all those bottles in, ask your pharmacist to do the look through with you. And also on some of them, if that price point is high and you've just been sucking it up and paying it, you may not need to. So starting to ask a little of those questions, is there another option for this? Is there a generic? Is the generic just as okay for me to take? And then remembering if you do switch to the generic, stay with the generic. We talked about the pill organizers. We'll put that in there. And then like Alisha said, I think it goes with everything with our health of not being afraid to don't think that you're being a squeaky wheel or don't think that you're being a pain. Like that's what our providers are there for is to help guide us.
Yeah. And you have to advocate for yourself and ask those questions. And I'd also say, challenge your physicians and ask, how long am I going to be on this medication? Because there are some medications that people are on for years and they never ask anything about it. It's like, do I still need to take this medication? And it's just something that you're just filling every month. And your doctor is reauthorizing it, but do you still have GERD or heartburn, or do you need to still take this medication? So don't be afraid to ask those type of questions as well.
Because also we didn't really talk about this at all, but nothing is without side effect.
Correct.
And so if you're taking something for heartburn, for example, there's certain different medications for heartburn that have a correlation that it appears to be linked to an increased risk of Alzheimer's or dementia. And so the if you're only taking it for a short period of time, it's probably nothing to be worried about. But there's certain medications that even if they seem very benign, they may not be. I mean, even something as much as like a over-the-counter sleep medication or something like a Benadryl. These things are not without side effect and not without potential long-term consequences. So don't think that, again, also just if it's over-the-counter, it's completely safe.
Yes.
Awesome. I really appreciate this. I'm going to put the links that we talked about. And again, if you want to hear more, want to learn more, follow Alisha. We'll have the link to her Instagram account. And then we'll also include the link to Alicia's podcast as well.
Thank you.
Thanks, Alisha.
You're welcome.
Always love spending my time with Dr. Alisha Reed. She is a joy. She's so peaceful. She's so knowledgeable, and she just brings so much to every conversation that she has and everything that she does. So I'll include the links that we talked about in the show notes of this episode. I would also love to hear what you think. As you incorporate some of these things into your own life, share it with us. We always want to know about it. I'm registered dietitian Molly Kimball. You've been listening to Fueled Wellness and Nutrition, the podcast. If you'd like more Fueled Wellness and Nutrition, please head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. And if you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next week for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life.